What does the pink arrow point at? We see air-filled bronchi within a background of opacified lung parenchyma. This is an air bronchogram, one of the earliest findings we learn in radiology residency. Again, it is a pattern of air-filled, low-attenuating bronchi on a background of opaque, high-attenuating, airless lung. This sign implies patency of proximal airways and evacuation of alveolar air by means of absorption, atelectasis, or replacement, i.e. pneumonia, or a combination of these processes. This chest X-ray shows a dense consolidation with an intrinsic air bronchogram, the presence of which should exclude a central obstructing lesion. Nonetheless, consolidations in adults should be followed to complete resolution to exclude underlying malignancy. This just turned out to be right upper lobe pneumonia. Coronal CT of a patient with pneumonia shows a dense right upper lobe consolidation with intrinsic air bronchograms that manifests as branching lucencies within the consolidated lung. In rare cases, the displacement of air is the result of marked interstitial expansion, such as from lymphoma. Here, in this adult male with a left lower lobe nodule and intrinsic air bronchogram, biopsy confirmed a low-grade B-cell lymphoma, the most common type of primary pulmonary lymphoma. Air bronchograms may occur in confluent interstitial disease, and bronchi are not normally visible in the outer one-third of the lung. Etiologies for air bronchogram include pneumonia, which is the most common, and those include infectious, lipoid, or aspiration. Be also to include neoplasms, lung cancer, particularly lipidic adenocarcinoma, as well as lymphoma. Again, consolidations in adults should be followed to radiographic resolution to exclude underlying malignancy. Alveolar edema, alveolar hemorrhage, and fibrosis from radiation or sarcoid can also produce air bronchograms. For example, this axial CT in an adult female with sarcoidosis shows upper lobe peribronchovascular mass-like consolidation with intrinsic air bronchogram, secondary to sarcoidosis. Alveolar sarcoidosis and mass-like fibrosis from sarcoid can produce such findings. This X-ray shows predominantly central pulmonary consolidation with intrinsic air bronchogram. This just happened to be a bat wing pattern of alveolar pulmonary edema. Lastly, this X-ray of an adult female after left upper lobe nodule biopsy shows a dense consolidation with air bronchograms. This was consistent with pulmonary hemorrhage, frequently seen after biopsies. You now know a lot about air bronchograms. Please subscribe for more awesome anatomy and radiology videos.